Thank you for joining me.
Yeah, thank you.
So you're Chief Medical Officer
That's
of
right.
Rose.
Yep.
Tell us a little bit about it. What's the problem you're trying to solve?
Sure. So Rose has built a digital ecosystem that's looking to provide a solution in the mental health care space. So what we've identified is that there is a major issue within mental health care of finding the correct provider for a particular patient at the right time.
Yes.
And then helping the patient and provider work together to provide a mental health care service that exists across time rather than just being when you're in your appointment. Within mental health care, appointments are hard to come by. There's a big lack of providers. And so we're trying to help the patients and providers work together to provide more efficient and effective care.
So it's a matching
So there's two major components of it. The first is a matching component where based on the patient preferences as well as based on the evidence-based research that's out there for who might be the best provider for a given patient, we have a list and a resource of providers that we're able to offer the patients. The second component is a patient-facing mobile application and a clinician-facing dashboard. That's meant to be used, the dashboard is used during the session. So the patient comes into the room, the provider and the patient are able to work together to determine what information is going to be collected in terms of assessments, journaling, etc. Make those choices within the patient-facing or the provider-facing dashboard and push it out to the patient-facing application in real time.
So this is, we're still live. We're going to be, I'm the patient talking to the provider, and at the same time we've got this digital assist to help.
Yep, so the idea is you're still getting the in-person care that you would normally receive. So the patient and the provider are still meeting together. They're still deciding what the care is going to look like, but they're using these resources that we've developed to collect the data in between appointments. So let's say you're seen at an appointment and then you're not being seen until 2 weeks later. That whole time the app is collecting data. So data on mood assessments, journaling. We're building in digital phenotyping to collect things like heart rate, sleep, etc. And then you go in and see your provider after that delay, and they are starting with a bunch of information that in the past they never had before.
Interesting. What kind of traction do you have?
Yeah, so we have 80 clinicians that we've onboarded in the last month. Our MVP just went live, so it's in the Android store and in the Apple store. Those 80 providers, I would say we have around 250 patients that are actively using the application. We completed a phase 1 clinical trial that was very successful. It showed that 80% of the patients use the application every day, and 100% of the clinicians used it at every visit. We also have traction within the reimbursement space. So this is a solution that providers can submit to insurance companies and be reimbursed for. So mobile health data monitoring is something that there are codes for now that providers can collect an ancillary revenue stream, which they've been pretty happy about.
Great. What's happening this coming year?
So this coming year, we're going to be integrating digital phenotyping and digital biomarkers within the application. We've signed a large contract with an employee assistance program, so we'll be rolling out to their 3,500 clinicians and over 20,000 lives that they take care of. We got accepted into the Hopkins Hexsite Accelerator program, so we're going to be integrating within Hopkins and into their primary care space. It's a app that works for primary care and works for those individuals as well. So within the next 6 months to a year, we'll be in a number of primary care sites and also taking care of a bunch of employees.
Well, great. Good luck with it. It sounds like an exciting year.
Yes.
Thanks for coming by.
Nice to meet you.
Okay. Bye.